When we're talking about that whole idea of the diagnosis of asthma, I want to get into talking about that in our discussion as well. We're going to take a pause here in our discussion with you, Dr. Schaeffer. We're talking with Dr. Janis Schaeffer on our program here on the Fan this Sunday morning. She founded the Breathe Easy, Play Hard Foundation. There's a lot to get to in the course of this discussion. And a little later in our discussion, what we'll do is try to work in some thoughts and comments from some of the people who are listening to us. Some of you may yourselves have asthma, or perhaps have relatives, friends who have asthma, and would like to ask a question of Dr. Schaeffer in our discussion. Well, good morning, everybody. This is Bob Salter on our program on Fan this Sunday morning. We're in discussion with Dr. Janis Schaeffer. Dr. Schaeffer is a pediatric pulmonologist. She's the founder of the Breathe Easy, Play Hard Foundation, and she has joined us in this section of our program on the Fan this Sunday morning. After our 8 o'clock update, by the way, it is Rick Wolf's Sports Edge along here on WFAN. Before we paused for our sports update and messages, I want to turn our discussion, you mentioned that then, Dr. Schaeffer, to the idea of the diagnosis of asthma. What's involved in that?
Well, after the suspicion occurs, it's most important that somebody gets checked out after the recognition of the signs and symptoms. And what I mean by that is that they should really seek out their pediatrician or a pulmonologist or an asthma specialist and go for a thorough evaluation, which should include a detailed history and a physical examination and pulmonary function testing. Because after the diagnosis of asthma is made, if it is indeed the case, partnering with a physician that is experienced in asthma is key, because no two young people have the same response to medications or the same set of asthma triggers. And it will take some tweaking based on feedback. It will involve a very good open line of communication with a doctor that you can trust and communicate well with. And that doctor will help to develop a customized asthma treatment plan specific for that youngster.
And when we talk about the idea of treating asthma, have there been significant developments in that area?
Yeah, there have been significant developments, certainly in the last 20 years since I've been practicing. There are a lot of good ways to control your asthma without increasing medications. There are some things, some strategies that can be adapted, and we outline those on the Breathe Easy, Play Hard website for parents and for coaches and for youngsters themselves. But in addition to that, the medications that are available that basically can open up the airways or reduce the inflammation within the airways have improved so much in the last 10 to 20 years. They're longer acting. They don't get absorbed into the bloodstream to any great extent, so there's minimal side effects, if any at all.
You mentioned the website. That's an excellent point for me to give the address, because I don't think I have thus far in our discussion. It's the 3dubs.breatheeasyplayhard. That's all, that's one word, breatheeasyplayhard.com. And it's a very comprehensive website in terms of the information that is contained there. When we talk about asthma, and you talk about this on the website, I want to share some of this information with people listening to our discussion today. What is it that is cited, or what sort of things are cited as causes of asthma?
You know, the asthma is caused by a combination of genetic factors and environmental factors. The truth is that no one two people probably exact same set of causes. It is a combination of both. We know that when one parent has asthma, the chance of their child developing asthma is 25%. And the chance actually increases to 50% both parents have asthma. So genetics plays an important role. And so far, several DNA regions on chromosomes have been identified with asthma, but nothing is the same from one patient to the next. There are environmental factors. We know that the air quality certainly plays some kind of role. You know, we know that in areas where there's increased ozone concentrations or particles from fuel exhaust when pollution is high. This increases airway sensitivity as well. We know that certain respiratory infections that children and young adults can get can actually trigger asthma symptoms. And in addition, we know that there are other things associated with asthma, but the truth is that each person is individual, and it is probably a combination of genetics and environment.
When you talk about something like exercise, which is obviously advocated for our society, and especially for young people in our society an awful lot, exercise at times can be a trigger for somebody who has asthma? Well,
90% of young people that have asthma have some exercise component. But that by no means that they can't exercise, they can't play sports for fun, and it doesn't mean that they can't even compete at the highest level. And that's exactly the point of the Breathe Easy, Play Hard initiative. We are trying to get there, that with the right evaluation, the right diagnosis, and the right asthma treatment plan, while it can't be cured at this point, it is very manageable, it's very controllable, and there are tons of examples of professional and Olympic athletes that have asthma and reach the epitome of success.
And we're seeing some of those examples, I'm assuming, in place in Beijing.
Absolutely. But yeah, Bob, you're absolutely right. I mean, there are so many long-term benefits of exercise, and I think that the other part of this is that as a pediatrician and a mother, I know what those benefits are, and I want to encourage all young people, with and without asthma, to exercise from an early age, because there are just so many benefits, including, long-term cardiovascular health, weight control, even things like increasing self-esteem, stress release. It's been associated with a decreased use of recreational drugs. It certainly improves anger management skills, or it can lead to the development of improved anger management skills. So there's a myriad of long-term benefits of exercise, and we want, since exercise produces healthy children, and healthy children become healthier adults, we want to start it at an early age.
Now, as I mentioned to you the other day when we were talking in preparation for our discussion today, I do not firsthand have knowledge of asthma, but I've known people who have asthma. One of the things that has always been a part of those people's lives has been this concept of the inhaler. How big a factor is that in the management of asthma these days?
Yeah, it is still a big factor. I mean, most young people with asthma use an inhaler. It may just be once or twice a day, or it may be just an inhaler that's used prior to exertional or sports activities. But most with asthma will be using it at some point during their life, either when they get sick or on a daily basis.
And for the use of an inhaler, how young can that start? I mean, do you start with babies?
We do. We have devices that we actually can attach to the inhalers called holding chambers. And it has a little mask attachment, and you can put it on a baby's face and give them 1 or 2 puffs of a medication that way. And then, of course, there are nebulizers, which are aerosolized little machines where the medication can be aerosolized. That's for the tiniest of babies. But we started at a very young age with inhalers with this holding chamber. And actually, that's another thing we actually have on the website, because each inhaler, each medication is used a little differently. We have this great video on the website which demonstrates how to use each type of asthma medication.
The website's very comprehensive at breatheeasyplayhard.com. We're talking with Dr. Janis Schaeffer, who founded the Breathe Easy Play Hard Foundation. She's talking with us on our program on the FAN, Sports Radio 66 WFAN. Dr. Schaeffer is a pediatric pulmonologist, and she is very kind with her time.